Healthcare workers have carried a huge burden in this pandemic, and the strain of that takes a toll. As the 2-year anniversary of the first lockdown in the province approaches, our Ontario Hub reporters spoke to some of those frontline caregivers. With us on what they heard in Thunder Bay, Charnel Anderson, who covers the Northwest for Ontario Hubs, and in the Hammer, Justin Chandler, who covers the Hamilton-Niagara region. Welcome to you both.
Hi, Dan.
All right, according to Ontario's COVID-19 science table in 2021, more than 60% of healthcare workers, including doctors and nurses, said they'd leave the profession post-pandemic. Justin, why is it important to bring their personal stories to Ontarians?
So the idea behind this series was that while a lot of people may have heard about harassment against healthcare workers or about stress that they're feeling maybe from organizations, or maybe just because they intuitively know that this is going to be a tough time for people working in these fields, we felt it was really important that people could hear directly from people, to hear their stories in their own words. And we think that that gives a really valuable insight into what's going on, and a really sort of personal level that makes it easier to understand.
Now, Charnel, many journalists have tried to cover stories on this, myself included, and trying to get people to talk about their experiences in the healthcare sort of industry. Why do you think it's so hard to get people to talk about it?
I think on one hand, it's just the nature of the topic. It can be really difficult for people to talk about issues like abuse and harassment and mental health, especially in such a public way. And it can be risky as well, right? If you're talking about workplace issues or your employer, and your employer catches wind of that, it could potentially cause problems for your livelihood. And that's what I heard from people that I spoke to that didn't want to go on the record, is that they're worried that if they speak out, they may lose their jobs. So for many people, it's really a matter of weighing the costs and the benefits of speaking out about these really serious issues.
Justin, for one of your articles, you spoke to a Hamilton nurse who had experienced harassment, and in her personal story, she had mentioned that, she always had to be between the patient and the door because that was sort of the quickest exit if anything had escalated. What did she say about the working conditions where she works?
Yeah, this was Sonia Bernhard in Hamilton, and she told me that, especially during the pandemic, probably once a shift, workers are going to be experiencing some sort of violence or harassment. I actually just spoke to her recently before we were recording this, and she says that she's recovering still from a violent incident that happened at her work last week where herself and several other people were hurt. So what she told me was that this was something that always existed before the pandemic. It wasn't uncommon to experience violence or harassment, but that now that hospitals are more overcrowded and nurses were doing more with less, it was just more likely that you were going to come up against something. And some of these things include maybe being thrown to the ground or being almost stabbed with a needle, which are things that she said she's experienced, or even sexual harassment and violence.
Charnel, hospital shortages have also taken a toll on healthcare workers. Some say that they feel like they're doing more harm than good when they're helping their patients. How does that affect someone like a respiratory therapist that you spoke to?
So I spoke to a woman who I'm calling Samantha. That's not a real name. She requested anonymity because, she's worried about what her employer may think of her speaking out. And so Samantha's a respiratory therapist in Toronto who's currently on sick leave, and she's been on sick leave since last year after being diagnosed with depression and anxiety. And it was at one point during the third wave when she realized that she wasn't sleeping properly anymore. She was losing lots of weight. She was crying more often. And she told me that going to work was like walking into hell. She said, if a fourth wave comes, I'm going to shatter. And so the biggest issue for Samantha wasn't necessarily abuse or harassment, but it was the breakdown of the team and the conditions under which they had to work. Because, of course, hospitals are interprofessional settings. Healthcare workers in different roles work very closely together, and they're there to support each other as well as the patients. But because of the sheer number of COVID patients and the severity of the illness, not to mention issues in healthcare that predate the pandemic, Samantha felt like she wasn't as effective as she could be. And as you say, she felt like she was doing more harm than good. And so that was, really distressing for Samantha, so much so that she was really reconsidering her career path. And thankfully, Samantha's been able to find support for her mental health. And it sounds like she would like to ultimately return to her job and be there to support her colleagues in their mental health as well.
Just in follow up on that, are there any mechanisms for reporting some of these issues so workers can get that support?
There are. I'll give you a yes, but answer. So,
Okay.
for example, I spoke to Leela Pa, who's a Niagara paramedic, for another piece in this series, and she was telling me about the harassment that paramedics experience. And paramedics can go to their employee assistance program. There's workplace violence programs, peer support. She says there's also a strong informal support network. But sometimes healthcare workers will say that's not enough. So, for example, Sonia Bernhard, she was telling me that for her, she actually cut back down to working part-time because she just felt that at the rate things were going, there wasn't enough support, and she would want to leave the profession entirely. And one of the things that she said was that she really thinks we need to flip the script when talking about burnout, because in her feeling, when we talk about people getting burned out, it maybe puts some blame on them. And she thinks that we need to look more widely at the system and ask whether people are getting the adequate support that they need, because it's her view that they're not.
Now, Charnel, you're in Thunder Bay, and I think it's important that we put some context into sort of smaller communities there. How does this play out in, say, the Northwest region that you cover?
When I think about problems with healthcare in Northern Ontario, one of the first things that comes to mind is persistent doctor shortages. So some communities only have one or two doctors to care for an entire community. For example, in Manitouwadge, a community of about 2,000 people, last summer their resident physician quit. And luckily, within a few months, they were able to hire two new doctors. But it goes to show how precarious adequate healthcare is in smaller communities when if one person quits, the whole community is in jeopardy. And that's not to mention First Nation communities where most often there's only a nursing station with nurses in the community. So attracting and retaining healthcare workers in rural communities is an ongoing issue. A recent study about this issue published in the Canadian Journal of Rural Medicine looked at physician turnover in rural and northern communities and found that there's a range of factors that influence a physician's decision to leave. And that includes a lack of career prospects for their partners, a lack of opportunities and amenities, and burnout. And so some of that is just kind of the nature of life in small northern communities, but problems like burnout and other mental health issues can and need to be managed in order to address the shortage of healthcare workers. So that's, one way that healthcare workers can be better supported. Another kind of more novel way that the Thunder Bay Regional Health Sciences Center is exploring is hiring PSWs to support its nursing staff. So the hospital's hired over a dozen full-time PSWs, and they're not a replacement for nurses, but they're there to kind of help lighten the load of patient care. And this is a temporary measure meant to address staffing shortages as the hospital resumes normal operations. But hopefully it does help to take some of the strain off of healthcare workers in the community.
Charnel, Justin, I want to thank you so much for coming on the show. Of course, these are some really eye-opening personal stories from healthcare workers, and it's an ongoing series at tvo.org, so I really want to thank you for your contributions there.
Thanks, Jan.
Take care.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.